And another bad news for today, the total number of infections in the province of Samut Sakhon has already reached 1,000 cases already. According to the Samut Sakhon governor, Weerasak Wichitsangsi revealed today that the province found 242 new cases of COVID-19, bringing the total number of recent infections in Samut Sakhon to 1,063. So far, 6,156 people in the province have been tested for the virus. 90% of them are migrant workers. The results are already out for 3,808 samples, while the remaining 2,000 and roughly 300 samples are still pending. Meanwhile, Thailand recorded another daily surge in new COVID-19 cases today with 427 cases, including 413 related to Samut Sakhon. The CCSA spokesman, Dr. Thavisin Wisnuyotin, told a news conference this morning that there are 16 Thais and 397 migrant workers from Myanmar among the new infections linked to Samut Sakhon's central shrimp market, which is the source of the new outbreak. 14 others are arrivals from abroad in state quarantine. Meanwhile, Public Health Minister Anutin Chanvirakul said he will propose to the cabinet today that more powers under the Infectious Disease Control Act instead of the Emergency Act be given to health officials to help them deal more effectively with the COVID-19 situation.
Hello, Swadikap. Nice to see both of you again.
We just have to ask, since this Samut Sakhon outbreak happening, have you been getting questions from the foreign embassy in Thailand?
Well, yes, of course, the numbers are a surge, of course, from the months that have passed in this year. Since the 19th of December, it's been a high number in Samut Sakhon. But this surge, of course, is something that we did not, was something that we actually knew was coming in one way or another because of the risk and how COVID would be able to move around and infect various people. So the various embassies actually have been in Thailand have been receiving information from the foreign ministry regularly and their nationals as well. So I think it's something that we just continue giving all the information that we have through the various channels. The spokesperson of the foreign ministry also gave an interview and had a weekly press briefing on this issue as well. So there's no lack of the flow of information in that sense.
Has there been any talk between Thai government and Myanmar government at all coming up or already talk about this?
So we have communicated with them as well as produced certain communication with the groups in the Myanmar language in particular as well. So aside from that, they would have to be cordoned off temporarily in their dormitories in Samut Sakhon for 14 days. Of course, all the food and amenities would be provided in the same way that if Thai workers were affected. So these communication included cooperation with the World Health Organization, World Vision, to produce media products and material information to the Myanmar workers in their own language and through their smartphone. Because there's this cooperation that we have with DTAC and AIS telephone companies, so that there will be a default in Myanmar language coming up in the cell phones of the Myanmar community here to give messages and communicate with them on what to do so that we can fight off COVID together. Of course, it's a big number in Samut Sakhon now, and they are asked to stay in their dormitory and they cannot leave. But that's something about enforcement, and I believe that the Myanmar government, the Myanmar embassy understands this because we're doing this for not only for Thailand, of course, but for their citizens as well who are working in Thailand and contributing to the Thai economy.
And since the latest outbreak is mostly related to migrant workers from neighboring countries, how would this affect the perception towards migrant workers on this issue?
Well, I like to say that, of course, the perception and the acceptance or the stereotype, in a bad sense, stereotype of migrants has always been a challenge for many countries around the world, whether it's in a good way, whether they say that migrants contribute or not, or they do not contribute to the society. But one important issue is that Thailand has been championing is about migrants' health, actually, and the migrants' rights. There are many CSOs in Thailand working on migrants' rights. The challenge of having a bad image of migrants is still there around the world, but for us, if people realize that we are taking care, we're treating the migrants as if they were Thai nationals in this context, in this COVID context, if they realize that, and if they see that we are really doing, they would see that Thailand has a different perspective towards migrants in a positive sense.
We will come back to you again tomorrow with all the update related to COVID outbreak.
Thank you very much for watching and we'll see you tomorrow. สวัสดี
ส
ค่ะ
วัสดีค่ะ